Well, pain is something that we all manage differently. Some can manage their pain with an over-the-counter pain reliever, while others need a type of opioid or prescription to cope each day. But if you're pregnant, you know that you're limited to what you can take to deal with back pain. And according to the American Pregnancy Association, 50 to 70% of pregnant women experience back pain. That's a pretty significant number. So we have brought in Dr. Chris Tomczak from Health Source Chiropractic to talk about alternative ways to manage your pain. Thanks for being with us.
Oh, thanks for having me.
We appreciate it. And you say regular chiropractic care can actually help women that are pregnant to deal with this back pain. What are some of the ways that that can help?
Well, most certainly it can help because, you know, as being a lady, you know that back pain and pregnancy tend to go hand in hand. It's pretty much a marriage, right?
Yes, it is. Especially that sciatic pain. That's what I had trouble with.
And a lot of ladies have problems with that, and that comes from a compressed or pinched nerve in the lower back most of the time.
Okay.
So, you know, when you're pregnant, everything changes drastically.
Yeah.
You start gaining weight, you start retaining water, you start putting excessive stress on the joints of the body and specifically the spine. So what chiropractic does, when especially today's modern techniques, is it very easily, very gently allows a lady to have a much more comfortable and healthier pregnancy, and it does this by maintaining the spine, especially the pelvis, and the nerves and the joints along the spinal cord and the spinal column.
Okay.
What we do is restore motion, restore alignment, so that everything is moving like it should.
Now, at what point of pregnancy is it safe or unsafe to see a chiropractor? Do you start, you know, 10 weeks in, 20 weeks in, when you find out?
Well, that's a great question. The earlier the better, because if there's already a significant issue to begin with, well, it's nice to get that fixed before you start gaining the excessive weight and you start getting the pendulous and large abdomen and so forth as that baby starts to grow and starts to move. So earlier is better.
Okay. Is there a point in which it's dangerous? I mean, if you're at 36 weeks, do you tell people to hold off until after you have the child, or can you continue up until you have the baby?
Another great question. When I was practicing, I had patients drive to the office to get checked by me on the way to the hospital. They were in labor.
Wow.
So
that's trust.
That's
trust.
That is trust. And what we do then is we make sure that pelvis is moving, flexing like it should be, and gliding to help facilitate and ease your delivery.
That's interesting. Very interesting. Now, and you mentioned too, about after the baby's born, you say holistic care and adjustments can be helpful for the baby, and this is new to me. I haven't heard this. How does that help the infant?
Well, let's just backtrack a little bit. You're a mother of two. That birth process is kind of traumatic on a mother, isn't it?
Yes.
Well, it's kind of traumatic on a child too, on that newborn. So you've got maybe a 5, 6, 7, 8-pound little child, very delicate, with a head like a grapefruit, remember? Trying to go through a tiny little opening, and that exerts enormous pressures on that baby's spinal column because it's twisting and turning, and so things can happen. Those little delicate bones can begin to shift a little bit, muscle spasms can set in because it's traumatic, and so by going in and delivering a very gentle 1 ounce or 2 ounce adjustment, we can get things aligned appropriately so that that baby is comfortable.
How, after delivery, a month after delivery, when should a mom bring their child in?
Oh, you're giving me flashbacks to practicing again. I've had patients bring their babies from the hospital. They got the little cap still on, and we very gently take care of them, and then off they go.
That is so interesting.
And easy to fix.
Very good to know for all you mothers-to-be out there. We appreciate you coming in and talking to us, and obviously check with your doctor to see what care is best for you. And coming up in our next hour, we're going to talk about holistic care in general and chiropractic care to deal with chronic pain, which a lot of people deal with. So we're going to talk about that coming up at 7:30. Doc, thanks for being with us.
Thank you.
We appreciate it. We'll be right back.